Breaking news tonight, President Trump's new target for reopening America. The president growing impatient with the virtual shutdown of the economy.
I would love to have the country opened up and just raring to go by Easter.
He's warning of suicides by the thousands if this doesn't end soon. But his timeline contradicting top health officials and state governors as cases surge to over 50,000 in the U.S. Nearly half of all Americans under stay-at-home orders. Tonight, where officials fear the next U.S. hotspots will be. The desperate battle at hospitals, a shortage of protective equipment as doctors and nurses fall sick.
Getting sick during a time when there's a pandemic is really scary.
And the new alert for pregnant women, spouses being barred from some delivery rooms. The showdown over that $2 trillion deal that would send checks to Americans. Also, could air travel in the U.S. be shut down? Heartbreaking mistake, a man dying after taking what he thought was a drug touted by the president to prevent coronavirus. His wife surviving and speaking out to us from the hospital. The growing crackdown in Europe and Italy, one of the deadliest days yet. And warning signs why some coronavirus patients think they're getting better when they're not.
This is NBC Nightly News with Lester Holt.
Good evening, everyone. Americans getting mixed messages tonight at a time we can ill afford it. COVID cases are exploding, doubling every few days in some communities in this country. Now, with calls at the state level growing louder and more insistent for Americans to isolate, President Trump, focused on boosting the economy, is talking about ways to get back to business soon, putting him on a potential collision course with public health experts who say this is no time to lower our guard. Our team is in place and leading our coverage. Miguel Almaguer with a reality check of where we are tonight.
With nearly half of the nation's population under orders to stay at home, tonight a skyrocketing number of Americans are testing positive for the coronavirus as states struggle to contain the deadly outbreak. In New York, the number of confirmed cases statewide is doubling every 3 days. Tens of thousands are sick.
We're not slowing it, and it is accelerating on its own. We're now looking at a bullet train because the numbers are going up that quickly.
With infections spreading fast, in part because of high density and commonly used surfaces, the governor says he needs ventilators for new makeshift hospitals like the Javits Convention Center. In neighboring New Jersey, a ventilator is keeping Jack Allard alive.
He's just a good boy.
Jack's parents, Jenny and Andy, say the recent college grad fell ill 10 days ago. Now in critical condition, the young athlete is fighting to make it to his 26th birthday next week.
He's in a coma, and the nurse was nice enough to bring an iPad and show us what he looks like, but, we're not talking.
Across the nation in Los Angeles County, 80% of coronavirus cases are adults 18 to 65 years old. And today, the city reported the first death in a patient under 18. But those most in danger of turning critically ill remain the elderly. Word this afternoon, 81-year-old legendary playwright Terrence McNally died from complications of the virus. Today, the president said he wants to get Americans back to work and businesses open by next month.
I would love to have the country opened up and just raring to go by Easter.
With the virus spreading fast, many governors are threatening fines, even jail times for ignoring orders to stay away from crowds. But there is no national mandate, and some leaders are choosing to stay open for business.
Many governors today around the country have put in place shelter in place. I am not going there.
In addition to Rhode Island, states like Florida and Texas have no statewide regulations to keep residents home, leading some to worry they could become the next epicenter for the virus. Our Sam Brock is in Houston.
All of the biggest cities in Texas, including this one, have issued stay-at-home orders, but not in rural areas where some residents tell me not enough is being done to keep them safe.
As the global crisis also continues to unfold, a symbol of world unity, the Olympic Games, has now officially been postponed in Tokyo. Swimmer Katie Ledecky was a gold medal favorite.
We know that this is the right call, and we can have a little bit of time to take a step back.
Tonight, a worldwide crisis hitting home as fear and uncertainty spread across our country.
In a White House briefing that just wrapped up, there is growing concerns about New Yorkers who have left that area and perhaps gone to other states. We are told that 60% of the nation's coronavirus cases come from the New York area. Anyone that's left that area needs to self-isolate for 14 days. It comes as the number of cases explodes in states like here in California. Lester?
Yeah, a very telling warning. Miguel, thank you. Now to the battle within the battle, and that's about how we protect those trying to help us. Yet some hospitals tonight are still rationing personal equipment, the protective equipment, and pleading for more from their states, the federal government, even corporations. Here's Tom Costello.
In ERs and ICUs tonight, a pitched battle to keep patients alive, but with doctors and nurses still running critically low on protective masks, face shields, and gowns. At Leominster Hospital in Massachusetts, doctors use paper bags to store and reuse their masks as they go from patient to patient.
We are there to be at the bedside, and we will be at the bedside no matter what. So you don't think about sort of your supplies or rationing, and if you need to be at the bedside, you're going to be at the bedside.
Some healthcare workers are already sick, like San Diego nurse Megan Usich, homesick and waiting for test results, afraid of infecting others.
We're feeling sick, we're trying to get testing, and either we're not getting the testing or the testing is taking 5, 6, 7 days to get back.
Experts continue to warn hospitals could eventually need hundreds of thousands of additional ventilators. A frustrated New York governor lashed out at the White House.
Where are the ventilators? Where are the gowns? Where's the PPEs? Where are the masks? Where are they?
But the vice president insists help is coming.
Earlier today, 2,000 ventilators were shipped directly to New York. New York is truly the epicenter of the coronavirus now in our country. 2,000 more will be arriving tomorrow.
Governor Cuomo says he's bought as much protective gear worldwide as he can, but probably only enough for a few weeks. Meanwhile, companies big and small are stepping in. Ford says it will produce 100,000 face shields. It's working with 3M to ramp up production of respirator masks and with GE to expand production of a simplified ventilator. GM and Tesla also promising to make ventilators, though experts caution it's a complicated process that takes time. In upstate New York, a small creative studio is also using its 3D printers to turn out face shields for hospital staff.
We can hear the urgency in their voice, and we feel that urgency. We're working as quickly as we can to get anything into their hands as possible.
Meanwhile, the pandemic is affecting lives beyond the ICU. Emily and Billy Shear are expecting a baby girl any day, but their hospital, like many in pandemic hot zones, is not allowing spouses in the delivery room.
I'm nervous at the prospect of what happens when something goes wrong, and sad about the idea that he just won't get to be there at the birth of our second daughter.
Also tonight, the FDA has approved a self-administered kit for people to use at a test site, swabbing their own nose, then submitting that sample for COVID-19 lab work, though it may take some time to roll out. Lester?
All right, Tom Costello, thank you. With the Senate close to a deal on that huge relief package, including checks for Americans, stocks soared today. Peter Alexander now with more on President Trump's goal of reopening the U.S. for business despite guidance from many health officials.
President Trump tonight explaining why he hopes to have the U.S., in his words, opened up on Easter, just 19 days away.
Easter's a very special day for me. And I see it's sort of in that timeline that I'm thinking about. I think Easter Sunday, and you'll have packed churches all over our country. I think it would be a beautiful time.
But that proposed timeline goes against what his top health advisor told NBC News just days ago about how long the pandemic will last.
I cannot see that all of a sudden next week or 2 weeks from now it's going to be over. I don't think there's a chance of that.
The president arguing the White House's social distancing guidelines could be eased to allow Americans back on the job.
We can socially distance ourselves and go to work, and you'll have to work a little bit harder.
And that the economy cannot wait.
You can destroy a country this way by closing it down. You're going to lose more people by putting a country into a massive recession or depression. You're going to lose people. You're going to have suicides by the thousands.
Top Democrats warning the president not to loosen restrictions too soon.
What the president is suggesting is really a formula for more uncertainty, more infections, and more harm to the economy.
Whatever the president decides, Americans are still subject to restrictions set by governors and mayors, including shelter-in-place orders and school closures. All of it as the Senate nears a deal for that $2 trillion emergency relief package. The bill's expected to greenlight checks to most Americans, about $1,200 per person, $3,400 for a family of four, and 4 months' salary for workers who are furloughed.
As for that Easter timeline, late tonight, Dr. Fauci weighed in, saying he has spoken with the president and that date is, quote, very flexible, that they will need to evaluate its feasibility first. Lester?
All right, Peter Alexander, thank you. And for now, the pain is only getting worse for American businesses and their workers as those job losses grow. Here's Jolene Kent.
Tonight, across the country, businesses large and small shedding jobs as the impact of coronavirus deepens. Major airlines grappling with the possibility of cutting even more domestic flights as so many take off nearly empty. Florida now mandating that anyone flying from New York, New Jersey, or Connecticut must self-quarantine for 14 days upon arrival. The airlines worry that other states may follow Florida's lead. In picturesque Hudson, Wisconsin, stores are closing their doors to adhere to the governor's new Safer at Home order, going into effect tomorrow morning. Art gallery owner Ruth Masenko has run her shop for nearly 20 years.
Yes, we can last, but how long, I don't know.
Throughout the country, restaurant reservations have plummeted to near zero as millions stay in.
It's been really frustrating, honestly.
Andrew Volk was forced to close the Portland Hunt and Alpine Club restaurant he owns with his wife, furloughing all but one employee.
There's frustration as to not having control over something that we've worked very hard to build. And there's sadness for our staff in not being able to provide them answers.
All this pain coast to coast is adding up. Jobless claims are surging, crashing some state unemployment websites, with the unemployment rate expected to hit 9% by the end of the year.
On Thursday, we'll find out how many people filed for unemployment claims, and that number is expected to be in the millions. In the meantime, businesses say even after this pandemic is over, they expect it'll take at least 6 months to recover. Lester?
Boy, this virus hitting us in so many ways. All right, Jolene Kent, thank you. We'll be right back in 60 seconds with the all-out campaign to recruit nurses and keep them safe, and desperation and heartbreak as Americans turn to unproven drugs. Nearly 1/5 of the world's population is under lockdown tonight now that India is the latest country to impose strict rules. But China, where the virus originated, is looking very different. Here's Richard Engel.
China is finally reopening. Visitors returning to the Great Wall. The Beijing Zoo open too. Even Wuhan, the city where the coronavirus broke out, is slowly returning to normal life after 2 months on lockdown. But India, the second most inhabited nation, is heading in the other direction, announcing a 21-day lockdown for its 1.3 billion citizens. In Italy, the death toll spiked again today, around 700, near record levels. But people are still breaking the rules. The country's mayors fed up. With the frustration, sacrifice too. An elderly priest who gave up his ventilator for a younger patient he didn't know died today. In the UK, organizational problems. Limits on public transport have meant that the subways still running are packed. One virus patient speaking out.
Please, none of you take any chances. I mean it.
I spoke to a mathematician specializing on how epidemics spread.
Do you believe the numbers that are out there?
I think it's very likely that most case numbers are substantially underreported. The US and the UK probably have many times more infections out there than actually showing up in the data.
Richard Engel, NBC News, London.
And we keep coming back to medical workers. There's so much demand for nurses right now that some hospitals are offering major perks to keep them and us safe. Here's Cynthia McFadden.
I love you. Across America tonight, millions of nurses are fighting on the front lines of a new war. Catherine Ramos is an ER nurse at a hospital just outside New York City.
We need to be together.
She spoke to us from her hospital's hallway with an urgent plea to nurses who may still be on the sidelines.
You have your license. Go.
Help us out. We're all in this together.
They can't get them in fast enough.
Michael Fazio is the CEO of Prime Staffing, an agency that recruits nurses for hospitals all over the country.
How many more nurses are you looking for than you would on a normal day in March?
I mean, at least 15, 20 times now.
Fazio tells us New York City hospitals are desperate for nurses, especially for the ICU and emergency departments. Last week, his team recruited 100 nurses for New York area hospitals. They need to recruit nearly 2,000 more. The money is great. Salary's twice the normal rate, which will put some nurses at $100 an hour or more. But perhaps more important than the money, keeping these nurses safe. So Fazio offers a range of protections.
My name is Jessica Gonzalez, and I'm an ICU nurse.
Like being driven to and from work in black cars, whose drivers are certified healthy.
I usually would take the subway or the bus. That eliminates all of those, say, like 50 to, I don't know, even 100 people I could possibly come in contact with.
They also deliver sealed lunches to the ICU.
I miss you, Mommy.
Offer childcare. And that's Nurse Ramos's daughter receiving an order of groceries.
Which is huge. I don't want to be the one spreading anything to anybody.
Giving nurses like her the strength to fight on.
You know, this is the war we're battling. These are the troops. We need them in there.
Cynthia McFadden, NBC News, New York.
Now to a heartbreaking warning. We spoke with the wife of a man who died after thinking he was taking a drug to prevent coronavirus. Here's Gabe Gutierrez.
They thought a drug could protect them from coronavirus, but tonight an Arizona man is dead after he and his wife made a terrible mistake.
This is the most horrible day of my life, and this feels like my heart is broken. It will never mend.
NBC's Vaughn Hilliard spoke with his wife, who's now in an ICU herself at this Phoenix hospital, and asked not to be identified. Turns out the couple ingested chloroquine phosphate, which is actually used as a parasite treatment for fish. She said she'd heard about it from President Trump.
We saw his press conference. It was on a lot, actually.
And then did you seek out chloroquine?
I had it in the house because I used to have koi fish.
But in fact, the president has touted another type of chloroquine in tablet form. It's a malaria drug that researchers are testing as a possible coronavirus treatment, though there have been no clinical trials proving it works.
There's a real chance that it could have a tremendous impact.
Another similar drug, hydroxychloroquine, has also been used to treat lupus and rheumatoid arthritis for decades. But now surging demand is causing shortages for lupus patients like Bonnie Lieberman.
I am considering half dosing my medication to make it last longer than it would if I took it normally.
Pharmacist Roger Paginelli in New York is now rationing the drug.
The demand has been absolutely beyond what we can imagine it has ever been for this drug.
It all highlights the confusion and desperation some Americans feel over hopeful yet unproven medical treatments for COVID-19. Lester?
All right, Gabe, thank you. Up next, a new warning about symptoms. Welcome back. Joining us now is our medical correspondent, Dr. John Torres. John, walk me through what the symptoms look like. For people who get this virus, what can they expect?
Well, Lester, unlike the flu, which hits you all of a sudden, coronavirus symptoms start more gradual, what people describe as a slow burn. People say, I had a slight cough, a headache, and a low-grade fever, and then they either recover or some people end up getting worse. And what we're hearing is more people 24 hours later ending up in the emergency room because even though they thought they were better, they start getting chest pain and difficulty breathing. The bottom line here is if you start feeling better, you still need to keep your guard up because you might not be out of the woods yet. Lester?
Yeah, what a lot of people would describe as a double whammy. All right, doctor, thank you. And that's Nightly News. I'm Lester Holt. Please take care of yourself and each other. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.